What is an IVF protocol? When we're talking about IVF protocols for the purpose of ovarian stimulation in the lead up to egg retrieval, what we're referring to is the set of medications that we're using during the course of the 8 to 10 days of shots to prepare for the egg retrieval that is geared towards getting as many of the eggs that are available to mature so that they can be extracted. And this is essentially a process of salvaging, because we know that at any given time point, there's always a bunch of eggs that are available at the surface of the ovary that can be seen on ultrasound, and they're transient and they don't last forever. So you might as well try to capture them all. There are essentially 3 parts to an ovarian stimulation protocol for IVF. The first is the stimulation part. And so this is FSH or combination of FSH and LH, also known as Menopur. The FSH alone is also known as Gonal F or Follistim, just to give you a few examples. And these are mimicking the same signal that your pituitary normally sends from your brain to the ovary to select and mature one egg. But we give them to you in the form of these shots of FSH and LH at a higher level to try to get as many of the eggs to grow. Those are usually going to be at the backbone of every single IVF stimulation protocol. The second component is, how are we preventing you from releasing the eggs? Because we don't want you to ovulate, and that's what your body wants to do naturally. And so we have to have an ovulation blocking tactic. And that's where the idea of having 2 different families of protocols comes into play. You have Lupron-based protocols, and then you have something called a GnRH antagonist, like Cetrotide or Ganirelix. They're both doing the same thing. They're preventing the brain from sending out secondary signals that would normally cause you to release the eggs, the final maturation step in ovulation. Lupron is interesting because you can take it for a few days and it can actually work to stimulate the brain to release more signal and internally stimulate the ovaries. But after taking it for several days in a row, it starts to downregulate the pituitary, and so you stop releasing LH. If you're using Lupron to prevent ovulation, it can be done in 2 ways. Either you're starting it when you're luteal before actually getting your period and starting the shots of FSH and LH, or you start it with day 2 or day 3 of your period alongside those FSH and LH shots, and you're usually taking micro doses of Lupron morning and night. And at the beginning, it's helping to stimulate the ovaries, but then eventually it's going to help prevent ovulation. And this is one of the more aggressive protocols that we typically use for patients who we expect to have a low response. With GnRH antagonist-based protocols, this is usually a drug like Cetrotide or Ganirelix that we're adding in halfway through the cycle once we see a follicle that's at least 14 millimeters or close to that size, and as estrogen levels start to rise, particularly above 600 picograms per milliliter. The third component to the stimulation protocol is the final injection called the trigger shot. And this can be either HCG, which is the same as pregnancy hormone, but it has a very similar structure to LH, which is what your pituitary sends out to make you mature and ovulate eggs. And so it's basically priming your ovaries for maturing the eggs and getting them ready to ovulate. And before they have the chance to do that, you're going to go in and retrieve the eggs. So you can either do HCG, you can either do Lupron, which is going to just force your brain to send out the LH to do that job, or you can do a combination called dual trigger. Nice thing about using Lupron or dual trigger, which is a combination of Lupron and then a much lower dose of HCG, is that it really lowers your risk of something called hyperstimulation syndrome.
The Lucky Egg book does a deep dive on everything you need to know about your IVF protocol, available for pre-order now.